Research is a global endeavour, and Australia certainly participates in a really meaningful way in the global research endeavour. But in a way that's almost apologetic, if you like. We are hidden. You might say that, yes, we're an island, but we don't have to have an island mentality that says only we can do what we need to do and we don't participate anywhere else. The opportunity for Australia to really stand up and shake off we're the second cousin, if you like, or we're not as good as elsewhere, is really now. For us to be able to think about the incredible research that has yielded amazing outcomes. We're talking about cochlea, we're talking about IVF, we're talking about Wi-Fi, incredible contributions to the world, and there's no reason that we shouldn't be continuing to do that and looking for other opportunities. We're seeing with the shift and changes in geopolitics and where the power bases are, Australia really needs to be seriously asking ourselves, who are we in that scheme of things and where is it that we want to be? I'm Nadia Levin, the CEO of Research Australia. We are a membership-based organisation that represents the whole of the research ecosystem, so that's from discovery science through to health services, biotech, medtech, pharmaceuticals, and of course charities, patient groups and foundations. So the whole ecosystem that participates in health, medical research and innovation. Funding for health and medical research in Australia comes from multiple sources, predominantly public funding, so government funding, and I'll come back to that. Private funding as well. We've got in health and medical research about 30% or just over is funded in the private sector, and of course there's philanthropic dollar as well. So those are the multiple funding streams. From a health and medical research point of view, we've got the National Health and Medical Research Council, so the NHMRC, we've got the MRFF, and we've got the ARC. And that's about $2 billion, $1.5 billion, or just shy of $2 billion disbursements per annum. How's it been going over recent years? Not good. We're actually seeing it decline in real terms as far as inflation is concerned. And that's due to a whole lot of factors. Simply the cost of doing research has gone up, workforce costs go up, materials go up, and research has not been keeping pace with inflation. So not only have we been seeing that there's not keeping pace with inflation, we're not seeing an increase. So in real terms, we are actually going backwards. Now, it's not that nobody's doing anything about it. I think that people are thinking about what are the opportunities, what are the challenges. From our perspective, from a Research Australia perspective, I think the time comes to stop describing the problem. I think we understand what the problem is. We've admired the problem for a period of time. It's what do we do to move forward? And I think there was a lot of work done last year by the federal government and other state governments as well around looking at strategically how could they be funding research broadly, innovation, of course, to stimulate economics, but what that looked like in terms of a national health and medical research and innovation strategy, a piece of work that Research Australia had been pushing for several years. And it was about putting some guidelines, if you like, or guardrails in place that say, we don't, it's all very well we fund things, but why are we funding those things and how are we going to evaluate them? So being able to have a strategic view of what that looks like to make those decisions in the future is important. We had the review into our research and development funding as well, and of course Ambitious Australia that has come out of that. So I think people mean well. From our perspective is how are all of those pieces coming together? How are they going to be funded? And how are we going to evaluate that they're being worked, that it has worked? And how are we going to evaluate that they've actually worked? Are we going to wait 10 years and say, well, gosh, that didn't work? Or, if we would have stopped that halfway through and pivoted to something else. So those are the pieces, the rigor around the governance of how those mesh together are the pieces the questions, if you like, that we're still asking. When we look at research, we're looking at it from an outcomes point of view, we're looking at it from an impact point of view, and they're not exactly the same thing. We might do a piece of research because it's adding to the body of knowledge. What those outcomes might be, we might not see for many years. On the other hand, we might be doing a piece of research with a very specific outcome in mind. We are going to take this piece of research and look at translating it into a hospital or a clinical setting, or a commercial setting for that matter. And there's a very specific line of sight, if you like, and we might be doing that through a clinical trial, whether it's an early phase clinical trial or a later phase clinical trial. But there's a very deliberate strategy behind that piece of research that's happening. And that's something that I don't think Australia has grappled with at this point, to the point that it's got an answer for what is the difference between an output, an outcome, and the impact. And I think that if we were able to get a grip on what that looks like, we would have more rigor around the sort of research we fund, and importantly, managing our expectations of what it is that we expect at the end of that, whether it comes from a private fund or a philanthropic fund or indeed public funding. And as those in the sector should be asking, and the public should be asking, if we are going to use taxpayer dollar to fund a piece of research, then we should be asking, what do we expect at the end of that? I will also make the point that failure is okay too, because research is not linear, and doing a piece of research that doesn't necessarily lead to the outcome that you might think it does is also okay, because it's equally important. We know that if you do it in a particular way, that's not going to work, it's not the most efficient, or it's failed for whatever the reason is, it doesn't matter. And that's something in Australia that we don't reward, we don't celebrate that failure. And that comes down to risk appetite. And that's part of the challenge as we see around the funding landscape in Australia, is how we look at risk, how we categorise risk, and how much risk we are prepared to accept when we make those funding decisions. Some of the recommendations that we've made are really straightforward. It's as simple as making sure that we have a strategic eye on what it is that we're funding. Why are we funding a particular piece of research? Have we funded it in the past? And where has it got to? Is it an area of endeavour that Australia should be investing in? And I think that's a really important question for us to be asking around any research that we're doing. It also comes down to what research can we afford to fund and what research can we afford not to fund. What does our population need? What does it need today? What does it need in the future? We're seeing a research budget, or a research pie, if you like, that's simply not growing. As I mentioned, it's going backwards. And we're seeing we have a lot more researchers as well putting in bids for that research money on a pie that's not growing, right? So we're seeing success rates of that research down. We've got our ideas grants, for example, where we've got success rates of around 8%. So if you think about all of that research that's not being funded, we're asking, is it not being funded because it's not good enough? Is it not being funded because there's not enough money? Is it a bit of both? Is it something else? Regardless of what the answers are, it's what are we doing about it? What can we do about it? And what are the changes that we should be making as a result? And so part of the recommendations that Research Australia is making is to have a look at that holistic strategic view. It's also about funding the full cycle of research. If you fund only a portion of research, then we're going to see that huge gap and that disparity between what's funded and what isn't. And that's where it comes to the direct and indirect costs. The cost of doing business, if you like. You don't walk into a store and pay for half of the product that you buy, and you pay for the product in total. And research should be no different. There's a challenge to that. We're talking about a research pie that's not getting any bigger. So if you're going to fund the full cost of research, as we should be, the question is, how do we do that? And it's not, there's not a spare bucket of money that's lying around, so it's got to be a strategic, if you like, step-by-step process to getting to funding the full cost of recovery, or as much of cost recovery that we can, but certainly not to the levels that we're seeing now or not seeing now. So as I go back to that pie, there isn't enough money in there to fund the full cost of research, or is there? And that comes back to what research are we funding and who are we funding. So once we've got those questions asked and answered, doesn't mean we're at the solution to that, but do we then need to fund less research? And if we are funding less research, what research aren't we funding? And that's not an easy question to ask or answer, because in an ideal world you would fund all of the research that we've got. But there's simply not enough money to do that. So we need to move on to the next bit that says, How do we fund the research that we need to fund as a nation to ensure that we're able to keep our population healthy and that we're able to participate, if you like, in the global endeavour that is research, and also use that to drive innovation and therefore productivity and opportunities around economic growth, jobs and the like. So Australia's traditionally looked to North America, to Europe as its markets, and there's nothing wrong with that. It's not a question of we have to stop doing that, of course not. But it's having a look at other opportunities that are outside of that, looking at Southeast Asia. How do we become a leader among nations that are closer to us? How do we not only, from a moral and ethical point of view, we participate in these countries' economies, but how do we do more of that? How do we empower them to become equal partners down the road? How do we have a look at the populations that we've got that create the critical mass for a global clinical trials destination, for example? So it's not just an Australia or elsewhere around the region, but it's all of us together that we're seen as a block, if you like, as part of global endeavours. We haven't even begun to touch the surface of what those opportunities look like beyond just looking at how do we morally and ethically help our neighbours. But there's so much more to that in terms of economic empowerment. And those are traditional markets that haven't been tapped. Of course, none of this is simple. There are all sorts of obstacles in the way, but that's the point. How do we move those obstacles out of the way? Becoming, trade partners with North America and Europe, there were also obstacles involved in that, distance simply being a part of that. But if we have a look at the energy needs of future world, and that includes Australia, of course, you might say, well, that's got nothing to do with health and medical research and innovation. Well, actually it has. If we talk about the data that our research community uses and generates and needs to generate to be able to conduct research, and we extrapolate that further to the sorts of new tech and new digital, things like quantum, that are AI, that are fundamentally changing the way we conduct health and medical research and how we drive innovation through that. These are hungry beasts. They consume huge amounts of energy. So we need to set up huge data centers. Is that an opportunity for us? And I put to you, even if it's not because we're too expensive, what does that mean from a sovereign capability point of view? Are we going to be buying that product, so to speak, from data centers that are located outside of Australia? And what does that mean when we see geopolitical tensions boiling over? So us having a look at a capability that we've got, not only to look after our population, which of course we should do, and thinking about the population we want to have in the future, but what are the opportunities around ensuring that Australia is able to look after itself, regardless of what's happening outside of its borders? And importantly, how do we contribute to what's happening outside of our borders? Take space medicine, for example. Now, there's an opportunity. Is Australia going to send a space rocket to the moon? Well, wouldn't that be absolutely amazing? In the very near future, probably not is the answer. But what is it that we can do that can contribute to that global endeavour? Is there a gadget, a gizmo, a piece of innovation that's been derived through incredible engineering, incredible research that can be part of global endeavours to do that? Those are the sorts of opportunities that we need to be looking at. And if we think about our funding system and how we fund and prioritise research, we're not really gearing ourselves up to take advantage of those sorts of opportunities that a future big, bold Australia needs to be looking at, not only to generate economic outcomes, to be able to afford to feed and fund our own population, but to be thinking about the jobs of the future, growing incredible Australian minds, and we know we can do that, but attracting incredible talent from overseas that says, look, the work that Australia is doing in this area is so advanced and there's so much opportunity to it, that's the place we need to go to conduct that research or to invest, whether it be in data centers or an RNA capability or whatever quantum or AI throws out as the next big tech piece, big innovation piece. That's the sort of big, bold thinking that we need to do. And it's almost counterintuitive because it's, well, how can we afford that? How can we afford not to do it? And doubling down on investment is the opportunity that we have to grab now, as opposed to we simply can't afford to do it and therefore we don't, because Australia will get left behind. And how are we going to buy our way out of that?